Welcome! We're diving into something that's poised to be a total revolution in healthcare. We're talking about how digital tech could completely change how we manage long-term health issues like diabetes or heart disease. But, for all the incredible promise, there's a flip side, and the risks are just as real.
And that really brings us to the core question, doesn't it? The one we're going to keep coming back to. Are we, as patients, as a society, actually ready to hand over parts of our health to a digital doctor? It's a huge question that gets into technology, trust, and really the future of medicine itself.
And make no mistake, we are at a massive turning point. The whole idea of what healthcare is changing. It's no longer just something that happens in a clinic. It's moving into our homes, onto our phones. This isn't just some small adjustment. It's a complete transformation, and it's all being powered by tech. Now, to really get why this digital shift is so critical, we first have to understand the problem it's trying to solve. And honestly, it's a huge one. The growing crisis of what are called non-communicable diseases, or NCDs for short.
Let's be real, our current healthcare systems are stretched to the breaking point. They were basically designed to handle things like a broken leg or the flu, short-term problems. They were never built for the kind of constant, long-term care that chronic diseases require. And the result? Exactly what you'd expect. People can't get the care they need, services are a mess, costs are just skyrocketing, and so many are left to figure out how to manage these complicated conditions all on their own.
But what if there was another way? This is where digital health enters the story, almost like a new hero, with this incredible promise of a better future.
So what even is digital health? It sounds like a big, complicated term, but the idea is actually pretty simple. At its core, it's just using information and communication technology, so everything from software to your smartphone to help with our health. That's it.
And you've almost certainly seen this stuff in action. It's the electronic health records your doctor pulls up on their computer. It's the health apps on your phone that you might use to track your diet or your steps. It's even those telehealth devices that can monitor things like your blood sugar right from your living room.
The potential here is really threefold. First, it's about empowering patients, giving us more control over our own health. Second, it gives doctors and nurses better tools to do their jobs more effectively. And third, it gives policymakers all this data to help them build smarter, more efficient health systems for everyone. On paper, it's a win-win-win.
Okay, the promise is huge, I get it, but now we have to get back to reality. The biggest hurdle here might not even be the technology itself, it's whether our current systems can actually keep up with it.
And this is the fundamental question for everyone, from hospitals to governments. You can invent the most brilliant health app in the world, but it's totally useless if the foundation isn't there to support it. So, do our systems actually have the capacity to handle this digital future? Because a great idea without a solid foundation, well, it's just an idea.
And when you start to look under the hood, you see some pretty serious cracks. We're talking about a lack of basic infrastructure, different computer systems that can't talk to each other. The costs are astronomical, and there just aren't enough people trained to run it all. So what happens? You get these fragmented projects where everyone's reinventing the wheel, and the way it's all funded just isn't built to last. These system-wide problems create some massive headaches for policymakers. How do you regulate these new tools to make sure they're safe and effective? How are we going to pay for all of this in a way that makes sense long-term? What about privacy? How do we protect our most sensitive health data? And maybe the biggest question of all, how do we make digital health a core part of our national health strategy, instead of just some little side project?
But here's the thing. Even if we could magically fix all those systemic issues overnight, there's another piece of the puzzle that's just as important, the human element. The best technology in the world is completely useless if people won't or can't actually use it. So this brings us to the other side of that capacity question. It's not just about the healthcare system. It's about us, the community. Are we ready? Are we as individuals, as neighborhoods, really equipped to handle this huge digital shift in our own health?
Just look at these numbers on how people engage with this stuff. It's fascinating. You can build the world's greatest health app, and still, a huge percentage of people will barely use it or just give up on it pretty quickly. It shows you a really critical truth. Building the tech is the easy part. Getting people to actually stick with it is the real mountain to climb.
So why do people stop? Well, on one side, you've got the barriers, the usual suspects. I'm just too busy, or this tech feels too complicated, or that it feels cold and impersonal. But on the other side, you've got these really powerful motivations that keep people going. A deep desire to feel better, and the chance to learn new ways to take control of their illness. The whole battle is won or lost right there, in that mindset.
And if you zoom out to the community level, there are even more hurdles. Things like people not having a great understanding of health in the first place. The digital divide is very real. Not everyone has access to good internet. Plus, you have widespread concerns about privacy. And on top of it all, this threat of infodemics, just a tidal wave of bad information about health online.
Okay, so we've laid it all out. The incredible promise and the really intimidating challenges. So the final question has to be how we close that gap. How do we actually forge a path forward and turn all this promise into a reality? Well, the way forward seems to come down to a clear, four-step plan. First, you have to invest. You've got to build that foundational infrastructure. Second, you need serious research to figure out what actually works and what doesn't. Third, you've got to evaluate everything and create strong rules for safety and quality. And finally, when you find something that works, you have to be ready to scale it up, to take it from a small test to something everyone can benefit from.
And this is really key. Governments can't do this by themselves. It's just not possible. The private sector's expertise in building infrastructure and scaling up projects is absolutely crucial. Real progress is only going to happen if it's a true collaboration.
Which, of course, brings us all the way back to our very first question. After looking at the amazing potential, the systemic roadblocks, and the very real human challenges, what do you think? Can digital health actually be a powerful enabler for better health for all of us? The answer isn't a simple yes or no. It's more like a yes if, and that big if is something we all have to figure out together.